Thank you all for joining today's Public Health Discovery Seminar Series. Again, my name is Cassietta Troywick. I go by Cassie. I'm one of the admission counselors here at the City Scott Weatherhead School of Public Health and Tropical Medicine at Tulane University. And today I am introducing Dr. Sarah Michaels, who will be presenting her Public Health Discovery Seminar Series on Why Are Eggs So Expensive? An update on avian influenza. During this presentation, please feel free to drop your questions in the Q&A chat, and at the end, we will answer your questions. So, Dr. Michaels, take it away.
Great. Thank you so much, Cassie. Appreciate all of your time today. And yeah, my name is Sarah Michaels. I'm a clinical assistant professor in the Department of Tropical Medicine and Infectious Disease. I'm also a Tulane alum. I had my master's in parasitology here and also my PhD in tropical medicine. And I've been lucky enough to be able to join the department that I graduated from. I teach a variety of graduate and undergraduate courses, and I'm particularly interested in diseases that are spread by arthropod vectors, especially mosquitoes, and also zoonotic infections. And so that's what really led me to find out more information about the current situation with avian influenza. And it's something that's super tangible to all of us right now, because I'm sure you've gone to the grocery store and either not been able to find eggs recently, or they've been so expensive. I think I spent, oh gosh, like $6 the other day at Aldi's. I was really disappointed that it had gotten to be that much. So I want to talk a little bit about how we got to that point, and what's causing these shortages, and a little bit more information about avian influenza and zoonotic influenza in general. And so let me see there. Oops, there we go. Okay, so I'll talk a little bit about the current situation. Again, a little bit more about avian influenza, a little bit about influenza biology in general, and how it's transmitted, and then what our concerns are for the future, for potential pandemics, and a little bit more about the current situation as far as animals and human cases, and then what potential transmission risks there are, or that would be good prevention tips and information. And then I'll make a few recommendations and then open up for any questions. So, yes, so this is just a screenshot from CDC's website on avian influenza bird flu. And so that's the other thing. It's hard, right? Because you hear all these different terms being kind of thrown around. Avian flu, bird flu, H5N1. It's a little confusing. Right now, those are all of the same thing. And what we're really seeing is that H5N1 or bird flu, again, is widespread. It's pretty widespread in wild birds and migratory birds. We've watched it spread across the United States over the last several years. And what we're starting to see is spillover events that are happening where those wild birds are transmitting that viral infection to domesticated animals, especially dairy cows, livestock cattle, and also chickens, both backyards, flocks of chickens, or commercial chickens. And then we're starting to see some cases in people that are in contact with those animals. And so right now, the good news is that the risk is low for people. There's a low risk of we're not seeing any human-to-human transmission. The risk to the general public is low, but it's something that we're watching really carefully. And so there's a lot of monitoring of people and animals going on. I'll talk about that in a bit more, and how those surveillance systems work. So as I mentioned, we've been watching the spread over the last several years. So again, wild birds can be infected with highly pathogenic avian influenza, or HPAI. And we'll talk about what that means too in a minute. The wild birds, oftentimes waterfowl, ducks, other migratory birds, really don't frequently have signs of illness. It happens sometimes, and we have seen some die-offs of those animals, but often as a good reservoir host, they carry the disease, but they don't have detrimental effects from the infection. So as they migrate across the US, they expose, think about them moving through areas and maybe landing in and around agricultural centers, maybe defecating or feeding in areas that they're contaminating water. And then you're having that exposure to those domestic poultry and to into livestock and other domesticated animals. And so we have a good surveillance system for looking for this specific virus, right? That's highly pathogenic avian influenza, something that we have long-term surveillance for. That's done through the U.S. Department of Agriculture through their Animal and Plant Health Inspection Service, or the USDA APHIS program. And so APHIS conducts this wild bird surveillance program, and ideally finding or knowing about this transmission and the trends and how it's spreading and where it's detected locally gives an opportunity both for the government from USDA and APHIS to prepare for this, but also the chance for farmers and the poultry industry to also prepare, to put in additional barriers to protect those animals, or to offer protection to workers, or to look at workers' health and safety in that environment. So this is just, so I'm going to be putting up lots of charts and graphs and maps, and some of them are a little more easily read than others. So these are directly from USDA. This is basically all states at this point have had some kind of detection since 2022 in wild birds. Some states have a lot of activity, some less or so. So you can see California has quite a lot of detections, and we'll talk a little bit about the cattle there. So this is a static map over time. And then the bottom map looks in the last 30 days. So where is activity at the moment? So it is actually today a beautiful, sunny, getting a little warm, not too warm. It's a little chilly the last few days, but we just came out of a few rainy days here in New Orleans. It's warming up. It's going to be beautiful for the parades that start tonight and are pretty much solid for the next week. But it is spring here, right? And so the migratory birds are kind of leaving the area of the southern US and returning back to more northern climates. So one would expect that we'll maybe perhaps see lesser activity in the south, but we might see new migratory birds returning to other parts of the country as they warm up as well. I was just going to say, I think I'm originally from upstate New York, and it is not quite warm there yet. Quite a lot of snow, actually. So I threw out some terms in this one. We talked about HPAI, that's abbreviation for highly pathogenic avian influenza. And so let's talk a little bit more about these naming conventions and why they mean sort of the same thing. So avian influenza is caused by influenza A type virus. If you look at this figure here, human infections of influenza are most frequently caused by influenza type A or type B. Now, type B is something that's basically just spread from person to person. It does cause a lot of disease, and we do have outbreaks of it on a fairly annual basis, but influenza A is what we'll focus on today. And the way we describe influenza A is we have this naming convention that's based on the proteins that are on the surface of the virus. There's a picture down at the bottom. The blue is the hemagglutinin, and the reddish pinkish color is the neuraminidase. Hemagglutinin or H proteins, there's 16 of those. H1 through H16 is how we abbreviate it. Just a few of those are what we typically see in human strains of influenza. Same for neuraminidase or N proteins, there's 9 of those, and there's just a few of those 9 that are common in human infections. But there can be different combinations, and when we start to see different combinations of these H and N proteins, they are considered different subtypes. So I mentioned H5N1. That's what we're seeing with avian influenza. For seasonal influenza for people right now, we're seeing H1N1 and H3N2 as well, pretty often. So Again, this is one way we describe this virus as a type A. We describe it according to the hemagglutinin neuraminidase proteins that are part of the exterior of the virus. And then we also classify it as high or low pathogenic, or pathogenic, based on the genetic features and the severity. And this severity is not related to human infections, it's related to poultry infections. So where do influenza eggs come from? If we're not just seeing them just solely between people, and we know that there's a variety of them and not all of them infect people, well, as you would imagine, human influenza A's start with avian or bird influenza viruses. And again, that's migratory birds. And we're talking primarily about water birds or waterfowl or ducks in this case. So again, we have this transmission pattern where we have migratory birds moving across the country, landing in places, infecting local birds, domestic birds like poultry, chickens in this picture here. And those animals can then go on to infect other animals, especially other livestock, and they can also infect people. In fact, I'll talk about it in a minute, but we have a human case of avian influenza in Louisiana who unfortunately succumbed or passed away from their infection. And they were infected by their own flock of chickens that they tended to. So we can have direct transmission from these animals to people, or we can kind of have this in-between animal that's infected and then later infects people. And this is sort of the part of the process that makes us a little worried. So and I'll get to that more. So influenza biology, basically these influenza viruses can infect a wide variety of different animals. They can infect, as we talked about, cattle, but also horses, cats, which we'll get to in a minute, pigs, like in the last picture. Pigs are an incredible mixing vessel. They are very similar. They can be infected by human and animal influenza, and they become a mixing vessel. And from them, we sometimes have strains that emerge that have pandemic potential. We also have a wide variety of other animals that are in or near water, things like whales and sea lions and seals, and we've seen those infected as we've had this wild migratory bird infection spread across the US. We've had a wide variety. Maybe you've seen it in the news, maybe you've seen it in your local zoo or other places where these animals are. And so it's not just this farm or domestic transmission. We are seeing it to wildlife as well. So as I said, we have this wide variety. Again, we're thinking about those combinations of hemagglutinin and neuraminidase and how we describe those. And what potentially can happen is that we can have reassortment. So when two influenza viruses infect the same host at the same time and then swap their genetic information. And as I mentioned, pigs are a great mixing vessel for that. But it's not exclusively to those animals, and it can happen with people as well. So you're probably familiar with what the flu is like. It's in essence a really bad cold, right? Often you have a headache and high fever, a lot of muscle aches and pains. You're very tired. You might have a severe cough and congestion. But for some people, the flu is not only with something that will last a few days, it could impact respiration, it could cause someone to be hospitalized, and in some cases, it can cause death. And we typically see those most severe cases of human infections in the very young and the very old, and also in people that are immunocompromised. And we do know there's some variation in the strains that can be more infectious than others, and some can more easily spread between people than others. So there's another way we describe sort of this process of reassortment and changes. So remember back to those H and N combinations. So if you look in this figure here, you can see influenza with these hemagglutinin neuraminidase base pairs represented in blue, and they go through mutations. And so as we have kind of our seasonal influenza, where people are getting sick and they're passing it to other people, there's going to be some change. Think back to COVID-19. When we had COVID-19 spreading through the human populations, there'd be slight changes, right, over time. That's drift, antigenic drift. You get new variants. That's what we call those changes in those viruses. And the tricky part about that is that change, even that kind of change between people as it spreads, can really impact our ability to mount an antibody response. So meaning that if you were vaccinated or if you had the virus or similar virus before, it wouldn't offer you full protection from disease in the future. And so that happens pretty often with viruses as they're spreading through populations, but less often and more concerning. And what a lot of the surveillance is really based on is that if we had entire segments of a human type virus and an avian type virus in the same vessel, again, here's the swine again, or pig host. If we had a human infection spreading to that swine or pig, and we had an avian type infection, that pig becomes a mixing vessel and can swap or have this reassortment that happens, and emerging from that can be a virus that's adapted to infect humans because it has a human piece, but also expresses this avian piece. And so we call that big change or that big swap of information antigenic shift. And the most concerning part about this is that we do have some, right, either from previous immunization or previous disease, we have some immunity to most influenza viruses. But if we have this new virus or newly formed virus, there's no prior immunity in the human population. And that could be really severe. That could mean a lot of disease, and it could potentially mean more severe disease, not always, sometimes. But it's something that our tools like vaccination wouldn't need to be altered and changed to be able to adapt to that as well. So again, the concerning piece, and I'm just going to move my toolbar so I can see a little bit. Yeah, there we go. No, wrong thing. Okay. Right there. Okay, excellent. Now I can see better. There we go. So again, there's this hypothetical strain emergence where you have these combinations that are in swine, again, in this photo, where you have the swapping out or major sections of the virus, and the people that are in closest contact to that animal, think about the poultry workers and workers with cattle that have had infections. That's, again, what we are concerned about. The people that are closest to these animals are potentially at highest risk of becoming infected, but also emerging from them a strain that has this pandemic potential. And so with that, that's not happened very often. That is something that's happened about 4 times over the last 100 years. I'm sure that you are all much too young to remember swine flu. That's something when maybe you weren't. My 18-year-old daughter was, I think, 3 when we had swine flu emergence. And we didn't see a pandemic, but we have at times seen a really new strain where there wasn't a lot of or any human protection to the virus. But in that case, that one kind of burned out in about 2009 and didn't really go anywhere. So not saying that you'll always get a pandemic from this combination, but the chance is there, the risk is there. And I also mentioned that we kind of also designate these viruses as high pathogenicity or low pathogenicity. And again, this is really based on their potential to kill chickens in specific. It doesn't refer to necessarily that they would be more pathogenic for people or other species of birds for that matter. But so you might also see avian influenza referred to as HPAI. So what's going on right now? I'm going to clearly state at the onset before I get too deep into it that there's no current human-to-human transmission of avian influenza. So the current risk to the public in general is low. And that's great. That's good news. There's no person-to-person spread. Currently, we have 70 human cases in the United States We're adding a couple, several each week and kind of a slow amount. When we've had one single human case fatality. And again, that was in Louisiana with someone who was elderly with some underlying health conditions. So I had to go to a few different sites for this information. As we have more cases, some of the data is being updated in some places. And so this information is from the CDC. This is a current map of where those 70 cases have been recognized. So most of the people, most of those 70 cases have had some kind of direct contact or known direct contact with infected animals. And the majority of those people have had contact with dairy cattle and either primarily worked with them. Maybe they were milking or taking care of those animals, and those animals were known to be infected. There were also people that this kind of second category, people that work with poultry or they culled poultry after infection. And then a few other people had, like our Louisiana case, had contact with known infected animals, maybe of their own. There have been 3 cases, though, where there's been no exposure source. And so those are the ones that are a little bit more concerning, because if you can't make a direct link to the exposure event, to the wild bird, to the domestic animal, is that an indication that there is low levels of virus spreading? And again, there's no indication that that's happening, but it's something to kind of keep an eye on, to look out for. This is from a different source of information, and in this one, not all cases are represented, but this gives you kind of a layout of cases and by state and their type of exposure. Incidentally, if you went to CDC's website and look this up, you can hover on the state and it will give you the same kind of information. So as I mentioned, majority of cases have had some link with dairy cattle. In specific, most of those cases have also occurred in California, where there's been a lot of activity among dairy herds. As I said, our Louisiana case, again, has had some kind of animal exposure, but there's been several that have had no known exposure source at all. So there's been one recognized in Missouri, and there's also been 2 in California. You've also maybe heard of one in Canada, another case earlier. So of these people, most of their illnesses have been mild. And again, most of them have had some kind of contact with sick animals. Our case fatality in Louisiana was over age 65 and had some underlying health conditions. The tricky part is, and maybe you've heard, that we've had a really big influenza year. And so there is concern that if we have all this rise in influenza cases, and a lot of them have been influenza A, are we missing some of the H5N1 or the avian flu cases? And so I'll talk a little bit more about the surveillance system and how that differentiates between that. But if you took a rapid test, a rapid kind of the test you would take for COVID that looks at antigens for viruses, oftentimes it's not going to be able to distinguish between the influenza A that's spreading and avian flu in particular. And again, what we're very concerned about, or what we are hoping to prevent, is that a person could also be infected with a seasonal strain of influenza and also avian flu. And again, that could, like the pig mixing vessel, could exchange genetic material. And so there is a lot of education, and there's a lot of push to make sure that people who work around animals are vaccinated for seasonal influenza as well, so that the situation does not arise. So what's going on in animals? There's quite a bit. There have been over 12,000 wild birds detected over the last several years, since about 2022. There's 51 jurisdictions, so that's maybe that county or parish if you're Louisiana. So it's widespread across the US. There's been quite a lot of poultries, and that kind of gets to the egg part of our conversation. But there's been millions of poultry infected. And again, those jurisdictions are pretty widespread. And there's been 973 dairy cattle herds infected, and 16 states have had dairy cows infected. So we would say that the dairy cow detections are widespread and ongoing and across multiple states, as are the wild birds. Poultry flocks, we're still seeing sporadic outbreaks, and we're still seeing some sporadic infections among mammals, wild mammals that are being collected, or maybe ones that are in a zoo setting. And again, this is another point in time, but you can also look at the detections by months and by state. And so you can see that there are some states that have elevated numbers for chickens. Ohio recently had a number of outbreaks. And we see it not only in commercial flocks, but also, again, those backyard flocks. So that leads us to kind of our cost of eggs increase. Again, as I mentioned, I spent almost $6 this week on a store I thought would have lower cost eggs, but I couldn't even find eggs in other stores. And so on average, on a national level, we're at about $8 per dozen. So this data comes from USDA. I found this information through your local epidemiologist, who I think is an excellent science and public health communicator, and I would definitely recommend to her Substack and emails. And if you're looking at these graphs and saying that they look a little weird in the background, is a picture of eggs underneath it. That's why they have those darker circles, just so you know. So again, think about our annual price of eggs and how it varies. Sometimes it fluctuates a bit, but we are well exceeded that. We're very, very high from the historical trends. And what we are seeing, as I mentioned, we're having some areas of the country, even though the activity is widespread, so we've had some huge impacts locally on production. And so there it is, Ohio again, it is at a 37% loss in their commercial egg layers. And again, it varies by state. Some states have a lot of activity like California, but it's a large state and they still have quite a bit of production. So this is USDA data. You can track that over time to look at kind of how those losses are being felt differently by states and the numbers of losses as well. So USDA in summary has continued to say that egg shortages are impacting most major markets across the US, but again, localized outbreaks. And we're still seeing new outbreaks of disease. And so what that's kind of leading to is that flocks are not farmers and commercial operations as well as people who are maybe hoping to raise their own chickens are not having very good recovery with their flocks. So they have new infections or they're not able to recover from those primary infections. And so again, as you've probably seen, there's been limits on how many eggs you can buy, how many dozens of eggs. And this is really not only the cost, but the availability has really heightened consumer concern. And that can sometimes lead to panic buying as well. So that adds to the shortage issue. So is it because is it because of a lot of disease that we're seeing, or is it because of maybe you've heard of culling? I know I've mentioned it as well. And it's a little bit of both. And so when HPI outbreak is detected, especially in a commercial layer farm, a chicken farm, let's say, it is highly advisable and more or less required by USDA that the remainder of the flock be put down or culled or killed. And this is for more than one reason. It really decreases the risk of spread beyond that animals' borders. As you can imagine, people, supplies go in and out of infected buildings and farms, and that could increase the risk. So say if you had a truck that went to pick up eggs at one farm and then went to another farm down the road, you could increase the risk of spreading that. In fact, there's been a lot of interventions on those people that come in and out of farms, basically to make sure that there's biosecurity in those areas. And, we call it highly pathogenic avian influenza because it does result in a lot of avian mortality. And so culling the animals does decrease unnecessary suffering in the animal and also allows the farm and farmer to recover sooner. We've also had widespread, as I mentioned, livestock and dairy infections, and there's kind of a two-pronged approach with surveillance. This is also managed by USDA, and there's a program to look at symptomatic herds, so the sick cows, basically, right? And so for cows, more or less, they get runny, stuffy noses. They kind of get some of the same symptoms that we get with influenza. So if that's detected, then screening of the herd is recommended. And there also has been this movement to test the national bulk milk supply. And the bottom figure has active screening processes. So none of those states it's been detected in milk, but that there's a milk surveillance program in place. And so these two pieces, this looking screening of the milk and screening of the cows has really, there's been a few surprises in the last few weeks. So again, more nomenclature about defining these viruses and how we describe them. So we've had this spread, right, as we've discussed so far, of H5N1 or avian influenza moving from migratory birds into animals, and that's been primarily a certain genotype. So think of a strain. So the B3 13 genotype. And that's what we mostly have been seen spreading. But recently, in the last few weeks, we've also seen another genotype in cows. So now we have at least 3 genotypes spreading in cows. This genotype, incidentally, is one that was responsible and related to the human infection, so wild birds to chickens to the person as well. So we've got multiple strains of H5N1 moving. And it also gives us indication that we're not just seeing one single event where there's one spillover that's happening from wild birds to other animals, but there are multiple events. And that's more concerning because it means it'll be harder for us to contain that. There also, as you probably know or have heard, the CDC websites were on hold as far as releasing data over the last several weeks. One of those reports that was held back was MMWR, or the Morbidity Mortality Weekly Report. This had information about a program from last year that looked at testing bovine veterinarians. 150 veterinarians attended this conference. They were enrolled in this study. They were tested, and 3 of those 150 cow doctors tested positive for H5N1. What was interesting about that, though, those were not the veterinarians that knew that they were working with cows that were infected. In fact, all of those people tested negative. There were one had practiced in a few states. There had been no reported activity at that point, and none of the 3 had any symptoms. So as we look at people maybe that interact with animals, especially sick animals, and the good news would be that if they take precautions, it often prevents transmission. But if they don't know to take precautions or they're not taking any and potentially exposing themselves, we are maybe seeing transmission that we're not detecting because those people weren't sick and wouldn't necessarily have been tested. So it just gives us an indication that there is some transmission happening, and is a good recommendation to take precautions around sick animals as well. So as I mentioned, we've had a really active flu year, and we've had this secondary peak of activity in the last several weeks. And as I also mentioned, influenza A is responsible for a lot of those infections, and the rapid test or most flu surveillance won't tell us whether someone has kind of the human type transmission, annual transmission of influenza A or this avian influenza that we're concerned about. So there was a move, and I was going to see if this is next. Yes. So in January, there was a health alert that went out from CDC that basically said, hey, hospitals and other people that conduct flu surveillance, we would really like you to also double check and make sure that you're not seeing avian influenza among those samples. And you should do that soon. Let's not wait. Let's kind of be proactive and look really quickly. And part of that too is that sometimes when people present to an emergency room or an urgent care, and they leave, it's difficult to follow up with those people. And so if we detect any people and they're already left the hospital or at the ER by then, we're not going to have all the information we need from those cases. So there have been 136,000 cases, specimens that were tested and screened for influenza A H5, and 6 cases have been detected through the system. So meaning that, yes, the majority of influenza A that's circulating in the US among people is not due to avian influenza, but we have been able to detect some cases that way as well. And as I was saying, influenza in general, it's been a very active year. If this is the kind of range of colors, we're in the darkest range for the majority of the country, including the Gulf South. We have been for several weeks. The good news, we've seen sort of a slight decline in that in the last several weeks. And sorry, there's some overlaps on this. I couldn't fix this text. These charts are provided by Caitlin Rivers from A Force of Infection, another great science communicator that I follow, who summarizes a lot of this data, and it helps to kind of keep up with it quickly. So as I was saying, the US is experiencing this high secondary wave of influenza. Some years we have a high second wave, but this is really well above what we normally see. So the gray lines are previous years of influenza activity. We are that red solid line near the top. We're in the last week, we've had a slight decline. Hopefully it stays that way. But we tend to have this long, prolonged tail of activity. So the season's not quite over yet. It just may have peaked. We are seeing most of those cases in children under the age of 4 and kind of school, college aged people that I teach in undergraduate aged, so 5 to 24. And overall, we've seen about 10% of all emergency room visits due to influenza infection. Some reasons behind this, some of it is that fewer kids especially are getting flu shots or getting vaccinated against flu than we would see on average before COVID-19. Again, a plug, it's not too late to get the flu shot this season. While our activity might have peaked, again, we have a very long tail. There's a long flu season left or remaining, and it takes about just under 2 weeks to mount a full response from a vaccination. We do have some variation, and this is some of the reason that maybe people don't get vaccinated every year is how well the vaccine works. You've probably heard that. Well, I got the flu vaccine and I still got the flu. Why should I get it this year? Well, you know, there is some variation from year to year how well the viruses that are in the influenza vaccine match what is currently circulating. A lot of that is a very well-educated guess, right? We have to kind of produce those vaccines about 6 months in advance. In fact, there's a meeting coming up, a global meeting to look at what strains are circulating on a global scale and start to make those predictions for the next season. So sometimes we're able to really closely match and through that surveillance data and information, the strain in the multiple strains, there depends on the vaccine you get, if it's very closely related or it's slightly different and slightly altered. The other thing, though, is that even if you are vaccinated, if you still get ill, you are less likely to be hospitalized and less likely to have severe symptoms off with your infection. So reducing the risk of illness and the risk of hospitalization. So this vaccine currently is for influenza A, H1N1, and seasonal influenza H3N2, and those are what is circulating predominantly in the US. Now, these vaccines currently do not protect against avian flu and avian influenza viruses, so not for H5N1. CDC had developed a candidate vaccine virus, so they have the tool that they need to develop a vaccine if needed. And there was some early agreements with companies to produce that. We're not at any stage where that would be recommended at that point. And again, having a seasonal influenza vaccine does also protect against this rare possibility of co-infection with the seasonal and avian influenza strain. Okay, checking my time. Cats. I know a lot of people that I've talked to personally have been really concerned about their cats and have lots of questions. I have indoor outdoor cats, and uh, yes, they're they're slightly feral as well. What we have seen is a lot of infection among cats, and that's been anything from cats that live in the barn, especially around those dairy cattle, feral cats, or solely indoor cats, and that's been kind of interesting. We've also seen big cats, cats that are kept in zoos or that are in the wild, so mountain lions, tigers, leopards, bobcats, all have contracted the virus. It has frequently been a severe infection among those animals. They do get kind of minor symptoms at first, loss of appetite. They might be sluggish or slow or have a fever, but it can rapidly progress to having neurologic signs. And so for cats, often that's like change in coordination or balance or circling, or sometimes tremors and seizures. And they also kind of have a runny nose, so discharge from the nose or crusty eyes, and then some have complications and respiratory signs. And so most often what we have seen when there's been investigation is that these cats have primarily been infected through consuming food. That's typically been unpasteurized milk. So again, if you think about those barn cats, like in the picture, they are on a dairy farm and they're getting some of that milk off to the side, and that milk is raw and unpasteurized, and that has spread the virus. There also have been exposed to raw or undercooked meat. The indoor cats in specific were particularly fed retail raw pet products and were infected in that route. And then in other cases, exposure to wild birds that were infected or poultry, to some degree livestock in general. So not necessarily just consuming raw milk, but being around sick livestock and their environment. And so if you think about the flu virus too, and one of the things we talk about often, right, is covering your cough, maybe coughing in your arm or not directly into your hands. We talk about surfaces and keeping surfaces clean, and we talk a lot about washing hands. And that is because the virus is pretty hardy and can persist in the environment on surfaces for a period of time. And we kind of often refer to that as fomite or fomite transmission. And so what we've also seen is people that work on farms where there have been infected animals. Now, those people unfortunately were not tested or refused to be tested, and maybe they were worried about their jobs and had a reason not to be tested. But they found that animals that lived with those people became infected. They were indoor animals, did not go outside, did not have raw milk, did not have raw pet food, but they were in contact with the clothing that the people who worked on the farm were wearing at home. And at least one cat rolled around in its owner's clothing when they got home. So in addition to not feeding cats raw meat or milk, there also is some advice by the American Veterinary Medical Association. And again, I'm not sure that I can keep my cats indoors. I don't think I would be able to, but ideally, if you can, that's an option. Or avoiding contact with sick or dead birds. In general, keeping them away from livestock, poultry, and their environment, again, because of that fomite transmission. And then zoos and other places where you have big cats have tried to also separate them from wild birds. So covering enclosures with netting, or if you have a backyard flock, that's an option. And then often for us, and us not being a vehicle to infect our pets, our companion animals, is washing our hands. Washing our hands warm, hot, soapy water, after handling, petting cats, after handling, engaging with, taking care of poultry and livestock, disposing of sick or dead wild birds, or filling bird feeders. A lot of people have backyard bird feeders, and making sure that if we're changing that out or cleaning it out, that we're also washing our hands. Another recommendation is changing your shoes or not tracking your shoes through the house, or maybe if you have a little bit more advanced biosecurity, washing your soles of your feet so you're not tracking those fomites into your house. And that can be maybe you're walking through a park where birds gather, or walking or refilling your, again, your backyard bird feeder. And of course, if you think your cat has been exposed, then to contact your veterinarian. This is just a map, again, of other mammals that have been found infected since 2022. There was a single domestic cat found in New Orleans. Unfortunately, there is not much information about that other than they did test positive for avian influenza, and did reside in the city proper. But you can see that there have been many domestic and wild cats reported from across the country. Um, as I bring up bird feeders, people often have questions about bird feeders. And the USDA does not recommend removing your bird feeder just because of avian influenza, unless you have poultry. So if you have backyard chickens, you want to somehow separate or keep your chickens separate and not contacting wild birds. So removing sources of food or water or shelter that might attract wild birds to your chickens, so to otherwise protect them against that exposure. And then keeping bird feeders clean on a regular basis. Songbirds incidentally don't get infected as often as we see the waterfowl and ducks and other migratory birds. So it's less likely they'll be infected, but it's always a good idea to use a kind of bleach water mixture to regularly clean out your bird feeder. And then, of course, wash your hands after that. Busy slide, so sorry. This is lots of information from CDC about other protective actions that people can take, avoiding contact with wild birds and domestic birds, wearing proper protection around known infected animals, especially if you work with infected dairy cattle. And please, please, please do not eat or drink raw milk or milk products, products made with raw milk. Pasteurized milk is the best way to keep you and your family safe, not only from avian influenza, but from a variety of other pathogens that are found in raw milk, bacterial pathogens as well. And also being careful about handling and preparing raw meat, especially raw poultry, and fully cooking meat and eggs before consumption as well. And then again, if you have concerns or questions, to contact your physician or veterinarian. And then, of course, the seasonal flu vaccine. And it's not too late for the season already. In general, the prevention on the human side of things is, of course, vaccination, but hand hygiene, respiratory hygiene, cleaning and disinfection of contaminated surfaces, wearing a mask. If I know it's become complicated in some respect and controversial in others, but wearing that prevention, that barrier prevention does prevent viral contamination of your hands and surfaces as well. So wearing a mask, especially when you're not feeling well, is still really recommended. If you work in healthcare, again, upping those PPE prevention measures, or if you work with animals as well. So I have a lot of those sources were great sources for information. CDC has both avian influenza specific pages and tracking information, as well as seasonal influenza. And that data is now up to date and being released on a regular basis. So we're very glad to see that. USDA in their APHIS program has animal-specific programs and data. You often have to look a little deeper. There might be a few web pages you have to go through to get there, but that is also frequently updated. And then also for your local messaging or your local risk and understanding that, state and local health departments and their websites and their press releases are very good sources of information. For us, that's the state of Louisiana and the city of New Orleans. They both have their own health departments. And then, as I plugged earlier, reputable science communicators. My recommendation is always your local epidemiologist and force of infection. And they really distill down a lot of this information, make it very easily communicated, and you're able to really kind of get a snapshot of what's going on over a period of time. And oftentimes, if something new or interesting happens, to change things. That's all I have. I am going to stop sharing now and see if there are any questions.
Thank you so much, Dr. Michaels, for that Public Health Discovery Seminar Series. As Dr. Michaels stated, if you have any questions, please drop them in the Q&A chat.
I'll be happy to answer other questions too about Tulane or the department or anything related.
Someone said thank you. Do you believe this will occur more often in the near future?
Um, which part? Yeah, I mean, yes, I think that the good part of surveillance is that we find out more every time. We find out about new animals and new events, new places. And we have found out that this spillover has happened multiple times. And so again, this is something that is probably not very easily contained. And so I think it will happen more and more. I think it's really rare, though, to have a pandemic influenza emerge from something like this. So while we're all watching it carefully, it doesn't necessarily mean that this is the next pandemic. And I know we all feel concerned about that. And okay, yeah. Can I just keep reading? Is that okay? Yeah. Are there any drugs given to cows? There's actually so I should go back. I didn't mention it, but there is this is chickens. There's a poultry vaccine that's available. And there's this big discussion, this big debate right now about if we're going to start vaccinating poultry. And so I haven't seen as much discussion in cows because typically what we've seen so far is dairy cows that are being infected. And so there's a little less comfortability with vaccinating or giving antivirals to cows. So I'm not sure about cows, but I do know with chickens, we're kind of at this point where there is a little more investment in developing poultry vaccines and making that available so that we can kind of get past this time where we have declining numbers of poultry. But I would imagine that there are some other tools that are being developed, given how widespread this has been. Yes, definitely. I mean, it has been, I have kind of pulled my classes. I realize that undergraduates don't go out and buy eggs nearly as often as the graduate students do, so I can usually pull them a little bit better. But I know even within New Orleans, there's been several times that I've gone to either small local chains or big box stores and not found any eggs at all. And I've heard places like Costco will only buy eggs if they're at a certain cut point. So if if it's too prohibitively expensive, they're not going to invest in it. And yeah, so again, I think that's why we're starting to look at maybe other options for poultry. So as I mentioned, USDA does recommend culling the birds in the flock that have not there'll be a subset, a few birds will be sick, and the recommendation is to cull the rest of the flock. And often farmers are reimbursed for that culling, but if they wait and the birds die from infection, they're not typically reimbursed. So there's incentive for them to cull the remainder of the flock, clear that out, contain that outbreak, and then move on. And no one yet is really talking about not culling birds, but they are talking about ways to make them more resilient. And vaccination is one of those options. So yeah, I agree. I only got a half dozen this week, and we are using them very sparingly. And yeah, so So in a way, yes, and in a way, no, to answer your question, Valerie. So H5N1 avian flu as a combination has happened before over time. And again, it's happened for several years. So yes, we've had avian influenza arise. And remember back to that kind of transmission and multiple animals involved. We've also had swine flu emerge several times in the 60s, in 2009. So we have variants that kind of move from zoonotic influenza into kind of the human population and start to see human to human transmission. So it happens. But we are watching this to see that this does not emerge as sort of the next pandemic influenza.
All right. So, oh, wait, got one more
Yeah.
question.
Um, So I was looking at this for water yesterday, but not for milk. But pasteurization really is basically just heating the water to heating milk to a boiling point to kill off pathogens that are present. And so for most pathogens, a rolling boil for a minute is enough to kill a virus or bacteria in a liquid. Milk, though, I guess, I mean, I don't know. I don't know, but generally speaking, avoiding raw milk in general would be the best thing to do. To utilize pasteurized milk only and consume that only. But I would say if you're going to heat it, it should be a sustained boiling point for at least a few minutes and then reducing it down. Yep, Cassie, you're
We're
me.
almost at our end mark, but thank you so much, Dr. Michaels, for your Public Health Discovery Seminar Series. Thank you all so much for joining today's Public Health Discovery Seminar Series. Please stay tuned to the other ones that we'll be hosting in the near future. Again, thank you all so much, and you all have a wonderful afternoon. Bye.
Thank you.